Hi, this is Sonia Hissett, and my report is on Dr. John Wennberg. Dr. Wennberg started a study approximately 40 years ago to evaluate hospital cost. At this point, when the study was completed, is when he started to notice that there were variations in care according to where a patient lived. He noted that one subdivision where he was doing his studies had a higher incident of appendectomies. However, if you lived one street over, when you would go to a different hospital, they had a appendectomy rate of approximately 20%. It was at this time that he really started researching what he calls the unwarranted variations in geographical areas. Dr. Wennberg has many successful stories under his belt. His number one study, The Unwarranted Variations in Healthcare Industry, Centers for Evaluative Clinical Services. He actually founded this. The Dartmouth Institute for Healthcare Policy and Clinical Practice is another foundation that he has started. And he currently is working on Informed Medical Decisions Foundation. He founded this, however, he believes that patients need to be more involved in the decision process of their medical care. Dr. Wennberg went to Stanford University. He then went to the McGill University Faculty of Medicine, where he obtained a degree in internal medicine and nephrology. It was at this point where he began to see the differences in medical treatment according to geographical regions, especially with the appendectomies in the area he was working. At that point, that prompted him to go ahead and get a master's in public health. He also then increased his interest in epidemiological studies. He graduated from Johns Hopkins with his internal medicine degree. He's also co-founded the Informed Medical Decisions Foundation in Boston, and he is a principal investigator and series editor of the Dartmouth Atlas Healthcare. Dr. Wennberg has received many awards for his services to the medical community, and those are Most Influential Policymaker of the Past 25 Years, Distinguished Investigator Award, Foundation's Health Service Research Prize, the Richard and Hinda Rosenthal Foundation Award, Ernest Emery Codman Award, and the Gustavo O. Linehan Award. Dr. Wennberg really focuses his philosophy on the variations of healthcare. He has stated, quote, "The idea that the care you receive is largely determined by where you live and not necessarily by what is most appropriate for you has become part of the common prevalence of healthcare policy," unquote. He also says that many areas that spend more money and provide more healthcare services often have worse outcomes than lower spending areas that provide less intense care. One of his big statements is that more care doesn't mean better care. He also feels that patients need to be educated so they can make better decisions and reduce utilization. He currently is focusing this part of his philosophy with end-of-life issues. He also would like to develop a process that enables patients to be part of the decision-making process. Medicare, he says, could reduce spending by 30% while improving the medical care of the most severely ill in America. Dr. Wennberg has had many contributions to healthcare policy for America. He's also attended multiple congressional hearings to help form healthcare as we see it today. So he's defined the map of American healthcare. His study revealed major geographical variations in healthcare. With that study, he established that what doctors do was less based on science but on professional opinion. His work on a national level discussion about healthcare delivery, quality, and efficiency, which also continues to help shape current healthcare reform as we see it today. He's developed the Evaluative Clinical Science Foundation, and he has an evolving concept of shared decision making for patients, by patients. The contribution of his unwarranted variations in the practice and outcomes of medical treatment. The Dartmouth Atlas. Dr. Wennberg established a new discipline and educational focus in the evaluative clinical sciences. He's introduced and advanced the concept of shared decision making for patients. Dr. Wennberg currently is still an active emeritus professor of community and family medicine. He is a director emeritus of the Dartmouth Institute of Health Policy and Clinical Practice, which he co-founded. And he's currently working on patterns of end-of-life, inequities in Medicare reimbursement system, and the underuse of primary care. Dr. Wennberg is a very important role model for nurse leaders. He is a pioneer in health policy. He was able to identify problems and develop a system to create solutions. And his organizational studies and findings support clinical advancement. His organization supports advancing knowledge by asking good questions, developing better measures, and better approaches to measurement. Dr. Wennberg's long medical history, his strive to make increased quality medical decisions and treatment to be universal across the United States does align well with my project. My project is about putting a provider in a triage area that would decrease patient wait times, increase patient satisfaction, and certainly decrease the potential for bad outcomes for having patients waiting in the waiting room. Again, this is a quality issue for emergency rooms throughout the United States. And I do think that my project does align well with the philosophies that Dr. Wennberg has displayed during his career. Thank you.